Anytime we went somewhere, I had to say, okay, where are we going? And are they going to have bathrooms available to me? Like if I go to a concert, how far away is the bathroom? Do I have to wait? Do I have to start going there when I think I have to pee? Or if I wait till the last second, I won't make it. And then when I'm driving a long distance, are there any rest stops on the way? So that adds to the anxiety. If I'm driving with somebody else, I'm the passenger. The whole time I'm thinking, am I going to make it till we get there without having to pee? Am I going to pee on myself?
Welcome to BPH 360, where bladder health matters. I'm Dr. Kuang, Cleveland Clinic trained urologist. BPH is not just prostate enlargement. It's about protecting your bladder. Learn to ask better questions, take control. For education only, not medical advice. For your care, consult your doctor. Today we're going to talk about what it's like to live with symptoms when you allow your bladder health to enter into stage 2 or stage 3. Stage 2 is when that bladder becomes overactive. It starts struggling, quivering, causing urgency, frequency, getting up in the middle of the night to pass your urine. These are overactive bladder type symptoms. Then stage 3. That's when urgency turns into leakage, when you can't get to the bathroom in time and you start to drip, you start to squirt, or heaven forbid, you actually empty out a very large portion of your bladder. This is the part of the journey where men start living smaller and smaller lives. Let me tell you about a man who thought he was living the dream. He was 55, successful, sharp, high performer. He had built and sold his company. He was finally going to enjoy the retirement he had earned. He planned this beautiful family cycling trip across Europe, riding for hours from town to town. Open roads, fresh air, good wine, good food, the kind of trip you imagined for years. But there was one problem. He had been ignoring the signals of a struggling bladder for a very long time. The slow flow, intermittency, urgency, frequency, getting up at night to pass his urine, and even a little bit of leakage. And on that trip, everything came to a head. Every 30 to 60 minutes, he had to stop. He was holding back the group, slowing down the ride, looking for a bathroom, looking for a bush, looking for a side road, and if he didn't make it in time, he leaked. He was embarrassed, humiliated, drained, not just physically, but emotionally and spiritually. What was supposed to be freedom became toilet mapping on 2 wheels. And when he got back from Europe, that was the moment when he finally said, enough. I need data. I need to understand what is happening to my bladder, my prostate, my body, and my future. Here's the first major point. These symptoms are common, far too common, in far too many men. If you recall, we met this gentleman in a previous episode who was struggling with symptoms of stage 2 and stage 3. And he reminded us, please don't wait until this becomes a problem. And he warned people, don't wait until you reach stage 5. By getting help, by getting your data about your bladder, your prostate size, and your prostate shape, you can find solutions that allow you to live the best version of your life. That's what he did. As you can see here, he made the choice to get his data, that it was not okay to be living with urgency, frequency, getting up in the middle of the night, and leakage. He wanted to prioritize his bladder health because he understood that he only had one bladder. It was not transplantable, and he was willing to make the decisions that he needed to make so he could live the best version of his life, incontinence-free and catheter-free. He knew that along with the brain, the bladder is the only other major organ that is not transplantable. He knew it was that precious that he needed to take care of it. Recognize this is a very common problem. Large studies show that these symptoms of your BPH, potentially prostatic bladder obstruction, are extremely common in men starting as young as 45. Now, if we look at this study right here, this is a Kuang study from 2023, looked at 36 countries, 222 studies of over 600,000 men and women. And when they looked at men, they found that 1 in 3, about 35% of men, had moderate to severe symptoms. And a lot of these symptoms are derived from stage 2, urgency, frequency, getting up in the middle of the night. There is some distribution that varies around the world. In Asia, it's 36%. In the Americas, it's 37%. Europe, 29%. Africa, 44%. And here in America, the number one reason why men go to see a urologist is because of BPH. That's correct. These are the symptoms that bring men into the office to seek help. And you can see here, it's far more than the reasons of a surgical follow-up, prostate cancer, a disorder of the penis, urinary tract infection, kidney stones, blood in the urine. But how common are stage 2 and stage 3? For stage 2, we can use a surrogate of that symptom of urgency, feeling the need to go. Often that's a sign of your bladder beginning to struggle and quiver. Well, they did a study in 2009 in the Journal of Urology, and we can see here in pink, that's urgency as a surrogate marker of stage 2. And we can see that as men enter ages 55 to 65, more than 1 in 3 men are starting to have symptoms of stage 2, the overactive bladder. But look, as you see men get older into their 70s and in their 80s, it's now 70% of men are having that symptom of urgency of stage 2. What about stage 3, urgency incontinence, that leakage if you don't get to the bathroom in time? Once again, if we look at that age group, 55 to 65, we're seeing about 1 in 5 men, 20%, are starting to have some leakage. And that starts to escalate rapidly so that by the 80s, we're seeing about 50% of men having those symptoms of urgency incontinence, stage 3, the rebellious child. So when we are talking about stage 2 and stage 3, I do not mean to say that, look, everybody has it, it's common, so let's ignore it. No, in fact, I mean the opposite. Too many men, millions of men worldwide, are dealing with this quietly. They're hiding in the shadows, often with shame and often without getting the proper help. We know this to be true. Too many men with that cowboy archetype who are putting on that armor of masculinity are unwilling to seek help. In fact, in this study, 1 in 3 men were choosing not to do anything about their bothersome urinary symptoms, which included things like stage 2 urgency frequency nocturia, as well as stage 3 urgency incontinence. In this study, they looked at over 23,000 men. Nocturia, or getting up at night to pass the urine, was the most commonly experienced symptom at around 50% of men. Frequency was in 11% of men, and incontinence was 6.5%. Only 1/3, 1 in 3 men, felt that these symptoms were bothersome enough to seek help from their doctor. That is why I want to slow down right here and say something very simple. If your symptoms are changing the way you live, those symptoms matter. If your life is organized around your bladder, that matters too. If you are leaking, that matters even more. Stage 2 and stage 3 are not just symptom labels. They are lifestyle labels. These symptoms are affecting men who cannot sit through a complete movie. These are symptoms affecting men who have to scout out every bathroom in a new building. These are men who have to pick an aisle seat on an airplane ride. These are men who have to stop drinking fluids before every meeting or only a small amount at dinner to minimize how often they have to get up at night to pass their urine. These are men who can't drive more than an hour or two without having to make a pit stop somewhere along the way. These are men who are saying no to traveling because they're afraid of leaking in public. In fact, I have known men who have had to memorize every single exit on the highway because they were traveling salesmen. And in fact, they were teaching me that urgency and the fear of leakage was ruling their lives, was ruling the road. In fact, I have known some men who stopped leaving the house unless it was absolutely necessary because of the fear, the anxiety of actually having an accident in public. I've seen some men have to improvise using a humiliating combination of household items to create a makeshift incontinence device for their leakage, using basically tissue paper and then wrapping a plastic bag around the end of their penis and then tying it to capture the leakage when they could not get to a bathroom in time. And it came down to the fact that they were too embarrassed to ask for help. This is real life suffering. We need to stop laughing this off culturally. Here in New Mexico, where I live, it's sad for me to hear that there's actually a term within the Hispanic community here called El Viejo Miau. That's completely normalized the fact that there's these old men who just sit on the porch and they leak on themselves. That's not okay. It's not part of just getting older. It's not part of aging. We should not trivialize all of this. A man leaking on himself is not a caricature. He is more than a patient. He is a human being, deserving of dignity and autonomy, seeking to become the best version of himself, a human becoming. Let's now listen to a man who has experienced stage 2 and stage 3, and let's hear what it's like to really live with it.
Not only because of the peeing thing's better, but it got rid of my anxiety. Because like I was telling you before, anytime we went somewhere, I had to say, okay, where are we going? And are they going to have bathrooms available to me? Like if I go to a concert, how far away is the bathroom? Do I have to wait? Do I have to start going there when I think I have to pee? Or if I wait till the last second, I won't make it. And then when I'm driving a long distance, are there any rest stops on the way? So that adds to the anxiety of, or and when I'm by myself, it's fine because I can keep something to pee if I have to pull over, get out or whatever. But if I'm driving with somebody else, I'm the passenger the whole time I'm thinking, am I going to make it till we get there without having to pee? That's all gone. Just for that alone, it's worth it. Of not having the anxiety of worrying about, am I going to pee on myself? Do I have to jump out on the side of the street or whatever?
And if we had a buddy or a friend who's like started to complain about this, would you tell them to look into it?
I've already told everybody that I know. That's because they're close to my age. I have one friend who's like 66, and I have another friend who's a little bit over 40. And I'm like, you need to start getting your checked. Go get checked. Start it now. Don't wait till the last minute when you're going to have something major done. Like, okay.
Once again, when you begin to understand that your bladder is that precious, it's non-transplantable, as you prioritize your bladder health, then you can start getting your data, prostate size, prostate shape, bladder function, to make choices about how to manage or treat both your prostate and or your bladder so you can live the best version of your lives. Live a life free of anxiety, free of shame, free of embarrassment. This is so critical. As he talks about, there is an emotional cost to living with stage 2 and stage 3. Yes, it is emasculating, humiliating, anxiety-provoking. As he talked about, men start to ask questions like, will I make it to the bathroom in time? Is there a bathroom nearby? What if I leak? Can people smell it? Can they see the urine stain on my jeans? What if I slow everyone down again and hold people back? And this is where you start seeing men start to toilet map because of the leakage anxiety. You start seeing them have behaviors of avoidance and isolation. And yes, there are now even phone apps, as you can see here on the screen. This is just a couple of them here, no disclosures, but you can see because this is so prevalent and common for both men and women, we now have software that helps us find the nearest bathroom so that we don't have accidents and we're not embarrassed. Think about that. We now are living in a world where we're relying on technology using restroom mapping technology just to simply function and live our lives. And that tells us how severe a problem this really is. We're now having to talk honestly about all the products and devices that men are having to use because especially of the leakage from stage 3. Common coping tools include male guards and shields for light leakage, absorbent pads, pull-up protective underwear, adult briefs and diapers, reusable absorbent underwear, bed pads for the mattress protectors for nighttime leakage, barrier creams, and skin protectants to reduce skin breakdown and irritation. And sometimes some men are using penile clamps to prevent the leakage or even external condom catheters. These tools can be very helpful. We are not against them. But if a man has already had a problem that has escalated from a thin shield to a heavier pad to a brief, and nobody is asking why, well, that's a real problem. I just want to show you some real life photos because I think it's really important. And you can see here, this is a man who's using a liner in his underwear, and you can see the stain of urine right here. This is another man. He's wearing a diaper, or depends, underneath his jeans. This man has found this device which goes over the end of the penis to collect little bits of drops of urine or squirts that come out when they can't get to the bathroom in time. One of the challenges is making sure this stays on. As a result, he was able to find this device which has a little Velcro strap that helps keep it secure and snug around the penis to prevent it from falling off. Stage 2 and stage 3 can really negatively impact your quality of life. Leakage is not just socially painful. It can actually cause injury. When that area of your body is constantly wet from urine that's been leaking out, squirting out, it can actually damage the skin, cause rashes, irritation, skin breakdown, causing you to use barrier creams, protectants to help protect that whole area, and can put you at an increased risk of urinary tract infections. And then symptoms of stage 2, if you're getting up multiple times at night to pass your urine, often you're rushing half awake to the bathroom, well, that can actually be dangerous. Having that stage 2 bladder with nocturia can actually be associated with falls and fractures in older men. As you can see here, this is an article from 2011. The association of getting up in the middle of the night to pass your urine, nocturia, with falls in an elderly group of men. This study found that if you're getting up 3 or more times at night to pass your urine, that puts you at a 28% increased risk of falling within 3 years. And it is also associated with an increased risk of hip fracture, as we can see right here. Bottom line, when older men are falling at nighttime because they're having to go use the bathroom, we are not just talking about simple bruises. We are talking about hips, hospitalizations, loss of independence, loss of autonomy, and sometimes even mortality associated with some of these hip fractures. Quick pause because this matters. This channel is built around one idea. Better bladder health starts with better data for better decision making. If you're a company working with diagnostics, therapeutics, or technologies that genuinely improve how we evaluate and manage and protect the bladder, there's an opportunity to become a founding partner of BPH 360, not to advertise, but to help move the standard of care forward through education. Now let's get back to the episode. Let's now talk about the medical guidelines that exist about overactive bladders too, as well as for stage 3, urgency incontinence, the rebellious child. Here in North America, they come from 2 organizations, very prestigious, the American Urological Association, as well as SUFU. What's great about this guideline is that they are menu-based. There are many different management strategies that you can choose from based on your data, based on your discussion with your provider. And we can see here what some of these management strategies involve. Number 1 are behavioral and lifestyle strategies like bladder training, time voiding, fluid restriction, caffeine reduction, pelvic floor muscle strategies, as well as optimizing your body composition and making some changes in your lifestyle. For one of my colleagues out in Europe, in Spain, Dr. Fernando Gomez, for example, he does a great job of sharing some great tips. So, for example, for urgency incontinence stage 3, that rebellious child, as you're feeling that incredible urge to go use the bathroom, and if you're worrying about not getting to the bathroom in time, he offers up some very simple tips to help buy you an extra 30 or 60 seconds. And they can involve things like curling your toes firmly for about 5 to 10 seconds, or even rising up on your tiptoes or heel rises for 3 to 5 reps, or even rapid pelvic floor muscle contractions that you can learn from your provider or your pelvic floor physical therapist. All of these quick tips can help activate the proper nerves to kind of fool your brain into giving you more time to get to the bathroom. Other options on this menu include medications. Specifically, you'll hear 2 types of names. One is antimuscarinics or even beta-3 agonists, and we'll touch upon that a little bit more here briefly. Then there are advanced therapies as well, and you might see them as fancy words like percutaneous tibial nerve stimulation, botulinum toxin, sacral neuromodulation. Lots of different words where we're trying to help control how the nerves are functioning and how they integrate and synergize with the signals from your brain to your spinal cord and out to your bladder. If you remember from the past, we've talked about how our inability to successfully transplant a functional bladder is due to so many nerves that exist that have to coordinate the brain with your spinal cord and your bladder to make things work. But that's why I wanted to show you a brief overview of this menu of options for overactive bladder, for urgency incontinence, because there are management strategies out there that can help you live with these symptoms. And it's important, but here is my bladder-centric message. If a man has stage 2 or stage 3 symptoms and signs of obstruction from an enlarging and tightening prostate, then we do not want to stop only at suppressing the symptoms. We need data, prostate size, prostate shape, bladder function, to be able to understand the full system from the brain to the spinal cord to the pelvis to the bladder to find real lasting solutions if it's warranted. And that's what we did for the 55-year-old CEO that we talked about at the beginning. He found out about his prostate size, his prostate shape, his bladder function. And the reason for that is he wanted to find lasting treatments, lasting management strategies that really depend on what is driving the symptoms. This system is so complex that diagnostic uncertainty always exists, and so you need data. Some men mainly need bladder-directed management strategies. Some men need bladder strategies plus some form of deobstruction where we open up that donut hole of the prostate. Some men need to be triaged to identify whether or not their bladder is struggling right now, whether it is at risk for permanent damage and dysfunction. And so that bladder can then get the data it needs so that we can help it function better. Too many men are being undertreated, undermanaged, because everyone is so focused on the symptoms and not on the whole system and seeing what's going on. If you are already in stage 2, urgency, frequency, nocturia, you may still be in a zone where things can be done with simple things like lifestyle changes, bladder strategies, fluid restriction, which can meaningfully help your symptoms. But if you are also obstructed from a tight, enlarging prostate, well, you need to do something more. You can't ignore those symptoms of obstruction, because if you are obstructed, you may need a deobstruction. And if you are already in stage 3, the rebellious child, urgency incontinence, where that bladder is squeezing without your permission, that type of leakage is really raising the stakes. And now we need to ask more urgently whether that bladder is obstructed, whether it's struggling, is it weak, is it strong, how weak is it, how tight is that outlet, and whether or not your bladder is now drifting and progressing further into the later stages of disease and needs help now. Quick comment on medications for the bladder. Medications for an overactive bladder, whether or not you're in stage 2 or in stage 3 with leakage, are really important short-term and or long-term management strategies. There are two main groups. One are anticholinergics, also known as antimuscarinics, and what they're doing is helping the bladder muscle not contract so hard, not quiver so hard, so hopefully having less urgency, frequency, getting up in the middle of the night. The other type of medication that also does that, that's the next generation, is going to be what are called beta-3 agonists. And yeah, these are all fancy words. They work in different mechanisms. So where anticholinergics are helping the bladder not contract or quiver so much, the beta-3 agonists are helping the bladder to relax better. So there's less urgency, less frequency, less getting up in the middle of the night, less incontinence from stage 3. Our medical guidelines remind us that please work with your doctor to understand what are the side effects with each of these medications, how do they interact with your other medications, so you guys can make the best decisions together about your health, about your quality of life. One quick tip is this website right here. It's acbcalc.com, and it does a nice job. One of the big issues we have in the world at large is we keep giving men too many medications. You got a problem, Mr. Smith, here's a drug. Still have that problem, take another drug. You still got that problem, well, increase the dose. Yes, medications can be very helpful, but we have to be careful. When we start adding in all these chemicals, we need to understand how they interact, because it could actually make your health worse. And so this website does a nice job before considering drugs like anticholinergics. List all of your other medications in here, and it can actually help you determine what is the risk you have by adding an anticholinergic for your overactive bladder to the mix. Additionally, you should probably have a discussion about the possible side effects seen with these anticholinergics, which could be dry mouth, constipation, some cognitive concerns. And the beta-3 agonists also have a different profile that you need to learn about. In general, they tend to have a more favorable side effect profile for some patients. Once again, talk to your docs, figure out what's going to be the best options to help you manage those bladder symptoms in the short term and or in the long term. But remember, it's not just about managing symptoms. It's also for men, because we have these prostates that are growing bigger and donut holes that are growing tighter. If you also have some form of obstruction that needs to be addressed, you need your data to see if that's an issue. Prostate size, prostate shape, bladder function. So remember, my message is that not everybody needs surgery. My message is everybody needs clarity. Clarity comes from data. Good data drives good decision-making. And with good data, you don't have to spend years guessing while your life continues to get smaller and smaller. The tipping point for the CEO in Europe was not that he had symptoms. He had had symptoms for a very long time. The tipping point for him was that his symptoms were now finally becoming incompatible with his life, with the life that he dreamed of, with the life that he had envisioned for his whole family. This is where too many men live. They are not sick enough to go to the emergency room, but they're also not comfortable enough to be really free. They are simply stuck in the middle, and that middle matters. If you are slowing down your family vacation, leaking on yourself, wearing pads, having to bring an extra change of clothes to work, or sleeping poorly, always tired all the time, feeling anxious about whether or not you can take a road trip, well, then you already have reached the point. You have crossed the divide. You have crossed that line in the sand where you need to get your data. You need to seek clarity. This is where men need to stop saying, I'm fine, I can manage, I can push through. It's just part of aging. And now it is time to start asking, what is the state of my bladder health? What is my data? What is the status of the man versus prostate trifecta of prostate size, prostate shape, bladder health, bladder function, so you can make the best choices about how to live the best version of your life, incontinence-free and catheter-free. Thanks for watching. If bladder health matters to you, watch more. Follow BPH 360 to stay ahead of your symptoms. Listen on Spotify and Apple Podcasts.